We're on to learning unit number 4, which is on Pender's health promotion model. And as you'll note too, the text that we're using, Pender, is one of the authors. So at the end of this learning unit, you're going to be able to describe the basic concepts and the assumptions of Pender's health promotion model, which we often say the HPM. And you're going to discuss the contribution of Pender's model to our professional nursing practice and the outcomes of our patients related to health promotion. And you're also going to begin your group work and be able to determine a theoretical foundation or a planning model for your health promotion group project. So you're going to do a couple of things. You're watching this video right now. You're going to read chapter 2 in your health promotion textbook. So this isn't a link, it's just a reminder. And this is a video that helps in hearing about Pender's health promotion model and seeing it on screen instead of just reading the words in our text. So the text is essential that you read about the health promotion model, but I found this video that maybe also will help you better to understand the model. If you're a real visual learner, you might want to go to YouTube. There are a couple other Pender's health promotion model videos. I found this one to be the most helpful, but you might want to go on and watch another one or two. And there's a few that are just a couple of minutes long. Then we're going to look at an evidence-based care sheet. And this is by Wooten and Balderrama. And it is an article about teamwork in nursing and building healthy teams. And I want to introduce you to this very helpful article as you just start off with your group work. So you're building a healthy team, a good group of 3 or 4 members. And we're going to come back to this article in learning unit number 13, and we're going to assess whether or not we had what the authors note to be a healthy team as we worked in our group. So you may want to look at this, or you do want to look at this article right now before you start off, and even you might want to come back to it, as you're working, thinking to yourself, am I working with a healthy team? And then your discussion board number 4 is asking you can use the health promotion project topic that you used last learning unit number 3 as a guide. Or if you've already met with your group members and want to use a topic that you guys have agreed to, that's fine too. But I want you to describe 2 ways in which you could influence your targeted clients, the people for your health promotion program, the people that you're going to impact. So I want 2 ways in which you can influence these targeted clients to associate positive emotions with health promotion behavior using Pender's health promotion model. So as you're looking at health promotion model and you're reviewing the video and reading your book, you may want to be thinking, okay, I've got to describe 2 ways in which I can influence my clients to associate positive emotions with health promotion behavior. It'll make more sense as you get through as you understand more about the health promotion model. So then we are actually starting out on our group project. So you've all been assigned to one of 4 groups. 3 of the groups have 3 members, and you can see everybody in your group's names on this. And 1 group has 4 members. So for this learning unit number 4, you're going to finalize your group's topic. Decide, yes, this is what I want our topic to be, and everybody has to come together and agree. And then you're going to also determine the foundation, the theoretical foundation, or the planning model for your health promotion group project. Maybe you're going to use Pender's model. So you can do this a couple of ways. As I've described a little bit last week, you have a collaborative document, and that's like a wiki. Everybody can add to this document asynchronously. You can use Zoom right under the left-hand tool tab. Let's get over to that for a minute. It's not showing up right now, is it? Well, in the left-hand tool tab, you will see the word group project, and you can click in there. This is just a link to it. And underneath is Zoom meeting. So you can use a Zoom meeting at any time. So you can get on the phone and talk with your members. You can meet face to face. You can use a Zoom, or you can each individually go on and use the collaborative document. It's better if you meet together. I can just put that out there. It seems to work better for all, but you have different options. And if you do have a Zoom or a phone call, something of that sort, you want one person perhaps to document on the collaborative document, but you're also going to make a note of who the members were so that I can assure that everybody's participating. So when I click on this link, it's the same link that I find in the left-hand tool tab. And you should have already watched this video for group project meetings, but if not, please do. This helps to explain all these steps. This is if you're struggling to decide on what topic or what population you want to focus on. Here are some good here's a good tool to use. It's the Erie County Community Health Improvement Plan, and there are some good priorities. So you might find that lifestyle behavior, disease prevention, mental health, something like this, you're going to look through and decide that this might be very helpful. For example, I put this down. If you're considering a health promotion project that's focused on vaping in middle schoolers, heck, check out page 14. There's some great information about vaping in middle schoolers under the lifestyle behavior here. So anyways, moving along, here are your directions. This is our first time that we are doing this. So we're using, this is topic number 1 that you're going to address because this is learning unit number 4. Finalizing your topic and determining your theoretical foundation planning model for your health promotion group project. So again, this is the instructions, and here are more instructions, and this is group 1. You may be in group 4. That's the only group that will show up for you, because only the members of each group will be able to access that collaborative document. So I explained this last week, but I just want to make sure everybody knows what they're doing and assure that you're answering this. And you can see you have a different question every learning unit now for the next few learning units. And next week, I'm going to introduce you to why we're doing this and how you're going to make a final group presentation, what's going to be included. And there's also another assignment that's all part of that, and that will be an individual paper. So we'll talk more about that next week. I want to get everybody up and running and groups meeting in whatever way they feel is best. Zoom, phone call, or using just the collaborative document. But I'll tell you, it is easier if you guys can find a way to get together once a week. So maybe for this week, you start with a collaborative document, and maybe you email each other and kind of find a good time and day of the week that you can get together to work on this. But again, it can be done just through the collaborative document. So have a good week, and you are working on health promotion and how significant that is. Health promotion and disease prevention, that's the core, truly, of nursing.